Okay, well, welcome everybody. Good morning on this icy, maybe snowy where you are, beautiful Friday morning. So this is Lynn Schrader with KHI, and I'm in our Des Moines office, our West Des Moines office actually today. So the team, the Agent Services team up in Fort Dodge is putting this webinar together for us this morning. So I want to welcome you all to the call, and then I'd ask the folks in the Fort Dodge office to just maybe go around the room and let us know who all's on the phone there in Fort Dodge.
Hi everyone, this is Tricia Helmers.
Hi, this is Katie McMinda.
Hi, this is Tricia McCaleb. And that's it. Okay. Well, good deal. Well, I'm going to turn it over to the team in Fort Dodge, and we are recording this presentation this morning, so I'll just turn it over to you guys and let me know if you guys have any questions throughout the time. I'll just mute my microphone here. Thanks.
All right, thank you. What we're going to do today is just go simply through the quoting processes for Wellmark and Co-Opportunity. We'll do the individual products first and group second. So what we're going to start with is Wellmark individual. What an agent would do is go to wellmark.com and log in as an agent. Sorry, this computer is kind of small. Now, if you'll notice, there is a new link on the broker screen called Quote, Update, and Enroll. This is where all of the ACA plans, the quoting tools, your status updates for any ACA plans will be in this link. So to run a quote and to submit applications, you'll want to click on Quote, Update, and Enroll. Below here, there are guides for screenshots as walkthroughs to help you through the quoting and the application process. But just to run a quote, you would just go into Quote, Update, and Enroll. This shows your dashboard. I believe eventually this will work for people. Ours shows nothing right now. This website had to be out October 1st, and so Wellmark didn't have a lot of time to get everything completed, so it still is in process, I guess. To run a quote, you would go into Activities, New Quote, and in this case, we're going to do an individual or family quote. So you would just simply click on that link. And this brings you to your quote profile page. My screen is, I've got to scroll over here so you can see the good parts here. Here you'll choose if you want to do just an HSA plan, an individual and family plan, or a dental plan only. The Blue Cross dental plans are available as standalone products in 2014, so you can just run a dental quote from here. When you do an individual and a family plan, the HSA plans will show up in your quotes, so it's not necessary to have to do both. They'll be blended in this individual and family plan. I'm going to use Webster City's zip code only because it does show that multiple counties cross this zip code line, and it's very important you choose the correct county. We've had some issues where if you choose the wrong county and it comes back being a different one, the rates can be very different. So it's very important you choose the correct county. Then I would hit Show Plans from here, and it's going to tell me your zip code falls into multiple counties, you need to select the correct one. So don't just guess on that one. Make sure you have the correct county if it falls on the border there. Okay, another important thing, here are all of our quotes. The PPO plans are hidden. They automatically default to show the HMO plans. So to view the PPO plans, you need to click on this arrow to get the PPO plans to show up. And if you like a plan or want to see what the member rates are from this screen, you can click on it and a screen will pop up that shows the husband and the wife separately with the total amount, including the fees on those screens. Those are just simple pop-up windows. What I'm going to do here is just select a few plans. We can do up to 3. And if you see, the quotes have just the health plan only, and then they do have including the supplemental accident. That's why so many plans appear to be showing up. I'm just scrolling down to show you there are 20 PPO plans, 10 HMO plans, and the HSA plans are on the bottom here, as well as the optional vision coverage and the dental. So you can quote all of the plans in one quote, not all of the plans, but the additional dental and vision. So I'll just choose, I think I selected 2 PPO plans up at the top, and I'll do an HSA plan here. And you can either go up to the very top again, or on the bottom, they show compare plans would give you the breakdown of all of the plans. Modify quote would take you back if you had a date of birth wrong or needed to change the county or add a child, whatever you needed to do. You can go to modify quote, but we'll compare plans here. Okay, so there are the 3 plans I've selected for the member. Up here, this is on the bottom as well, at the bottom of the quote, but it does show plan details. This is a very nice sheet to explain the benefits for members. And then there is the SDC, that's the legal document that you have to give the member once they choose the plan. Here it shows the total monthly premium, the type of policy it is, or the type of network, whether it's a PPO, and then the HSA plans, your deductibles, out-of-pocket maximums. Here during lab and x-ray services, this seems to get somewhat confusing. It just shows covered, but we're not sure how. You will find that information in the plan details up here. It shows you, it gives you a nice PDF about the plan, and it actually goes into detail as to how the benefits are covered. Get one to pull up here. It does show your co-pays, and I wanted to look at the x-ray. See here on the SBC, it just shows as a covered service as well, but here it actually gives you a routine test. If you had x-rays and diagnostics, there's no charge. It's included in your office visit copay. Well, this would be imaging in office. Here is out of office, then it's deductible by 20% coinsurance. So it really goes into a lot more detail than the SBC as far as how your benefits are covered. Now from here, if a member decides to select a plan, you would just hit apply, and it would take you into starting a case, a profile for the member. It would save the quote and then allow you to go on to actually submit the application. So here's where it would save your contact information. So if you didn't have all of it, you could go back into it. One important thing to remember is we're seeing a lot of duplicates out there on the system. If somebody does submit an application and needs to find status on it, we have to go through several cases sometimes to find the one that was actually submitted. So if you have run quotes and saved the member in there and they want to come back and apply another day, what I would suggest is, let me try to get back up there. Up in this case name search, if you know the member is coming back in and you've already saved a quote for them, put in their last name there, and it will pull up their file, and you can go ahead and apply through there instead of starting all over and entering the information all over again. That causes duplicates, and it is holding up some applications at Blue Cross. They're having to go through several records to be able to find the correct one and make sure there aren't two applications out there. So just an FYI on that, I guess. Just make sure you're going back into the same record and applying from there. Now, once the application is submitted or sent to the member, you can't go back and make changes. So you have to withdraw that application and start a new one. But just to get a quote, this would be a very simple way to get a quote for the member, and you can save it in there just when you go apply. Make sure you go back into that same record. Does anybody have any questions about how to run an application through Blue Cross Individual? Okay, Carol, do you have a question?
No.
Okay. Okay, I think we'll move on to the co-opportunity individual, and Katie Nickvenda will be presenting that one here.
Okay, we're going to go through how to do an individual quote on co-opportunity. Similar to all the other carriers, you do need to go to their website, log in as a broker. Okay, so for an individual, you go over here to the right where it says individual market new sales. You click there. That does bring up another window.
Katie, this is Lynn. Can we also just comment that these same plans that we're seeing with Co-Opportunity are both on and off the exchange? We happen to be doing it off the exchange right now, just directly at Co-Opportunity's site. But if we went to healthcare.gov, we'd get these same plans with Co-Opportunity, right?
Right, and there are a few more available on healthcare.gov with the cost-sharing reductions and whatnot.
Thank you.
Okay, so off to the right, there's the little box with those 3 lines. You click on that, it gives you your options. Click on individual, you can do a new quote, a proposal, application. So if we go to a new quote, it's going to be really similar to how you do it with Blue Cross. Okay, and this is going to, when you get the quote, it will bring up all of the plans, all the different network choices. Off to the left, you can filter it if you know what you're looking for, depending on the metallic tier or possibly the network. You could go ahead and filter it and just look at ones available in that network. Similar to Blue Cross, you can compare up to 3 plans side by side. I mean, you can get the product brochure, the outline of coverage, summary of benefits. They do have live links in here that you can search the formulary, look for doctors, quite a few different things. And you could also, select the plan and apply from here. Co-Opportunity does have a couple different tools. If you're wondering, is this person going to qualify for a subsidy? Is it worth my time going out to healthcare.gov? If you go into Tools and click on ACA Individual Calculator, you can put in their information. It'll ask, zip code, date of birth, annual income, and do, it's going to ask you if employer coverage is available, all those different things that you should be discussing with them as far as if they'll qualify for a subsidy. And this page will show you, what you put in, $33,000, 2 people in the household. So the estimation is there at 213% of federal poverty level. It estimates the tax credit would be about $56 a month. If you click Get a Quote, it'll then show you what the plans would be with the tax credit applied. So just for example, this one at the top says $138.95 a month with the $56.66 tax credit, or $195.61 direct. I have noticed that Co-Opportunity is conservative when they're estimating tax credits, which is nice. It's not telling someone that you're going to get a big tax credit and it's half that when you go out there. So it's a pretty good tool. I know I've personally used it a few times to see how much somebody would get. And if they didn't get much, we have found that maybe some other carrier without a tax credit is more affordable. But to apply with the tax credit, because this will show you a few different plans that you won't find when you quote Co-Opportunity just direct, the cost sharing reduction plans, where they have lower deductibles, lower out-of-pocket. All of these plans, when you use this tool, it's just a tool. You have to go to healthcare.gov, create the account, go through the process with the member. If you click Apply here, honestly not even sure if it lets you, but if it does, you would be applying direct with no tax credit, and there's no way to go back without withdrawing the application and whatnot.
Katie, this is Lynn. Can you just share with them too how that emails out to somebody?
Sure.
Like I think you select one of the plans and then you can actually email them, you know, the actual link, and they can go through it and decide. If they know which one they want, then they go ahead and can actually apply electronically.
Yep, we can try that. I've never actually done that. We might have to go back out to just the regular quote. I think because I am in the ACA calculator, it probably won't let us do that. Let me go out here. Oh.
Well, and you guys are noticing too, Katie's typing this in again. If you save, at some point during the process, you can save, so then you don't have to keep rekeying stuff in. You want to be able to save your quote and or save your, you know, before you enroll it, you got to email it to the client. So here, we'll let Katie finish up here and show you that.
Yep, and just like Blue Cross, if you're going to save it, you need to go back into that profile. Otherwise, we're going to end up, you know, kind of in the same boat as Blue Cross. A lot of stuff's in admin review because we have duplicate profiles. Okay. So I selected a plan, and it looks like it puts it in your cart up here. So if we go there, this is where you're going to send the proposal. You're going to put their name, email address, and it's going to send it. Now, when this sends to somebody, it's pretty basic. They're not getting a lot of information. I've seen some of the proposals, and it comes through pretty similar to what you're seeing on the screen. So it wouldn't be a bad idea if you already have their email address to maybe send them a summary of benefits also, so they have the complete information. So here you can save it as a PDF, you can email it, or you could go ahead and start the application. Co-Opportunity does have a paper app for taking information only. You can fill out the app with a member, have them sign it, and then go ahead and enter it online. We cannot send those into Co-Opportunity. So up here, the email address, their name, that's the information you want to input before you can go ahead and email it to them or start the application. And I'm not going to put that in. Okay, it looks like we have a couple questions. Sherry Sitzman, yes, this is being recorded. Hopefully we'll be able to, in the next couple days, hopefully maybe get that out either on our website or to you guys. Paul, did you have a question? Did you have a question, Paul?
Yep. I don't know if you can hear me.
Yep, I can.
You can hear me?
Yes.
Okay. I duplicated a client on Wellmark. I'm not sure how to fix that.
If you I'll pull that up there. Okay, so Paul.
I think you muted yourself. I don't hear anything. Hello? I think you guys muted everybody else. Yeah, I'm not hearing you at all now. There we go. I think I'm hearing you now.
Okay.
Thank you.
Okay, can you still hear us?
Welcome to GoToWebinar Web Events. Welcome to GoToWebinar Web Events Made Easy.
I think you went away again. I'm sorry. I'm not hearing you. I'm not hearing anything. So maybe, Trish, after we're done here, I can connect up with you.
Okay, sorry about that. We had some technical difficulties. We are back. Okay. Back to your question, Paul. How do you find somebody if you've created a duplicate? Like Tricia said, you go up here on your Q dashboard with Wellmark. You can search by case name. You just enter the last name. It's going to bring up 2 profiles for you for that person. You'll need to go into them and look and see which one you submitted the application under. The one you did not submit the application under, there's a button to withdraw. They'll still show up as having a profile, but it'll be inactive, and only one will be active. So it'll help you going forward, because eventually when this website is built fully, you'll be able to make changes, go see things that are going on with the client. So this way, if you only have one active profile, you'll know which one to go into, which one's active, and then it'll help Wellmark when they're issuing applications that they won't have to do a review for all of them. Okay. All right, I'm just reading some of these questions you guys have typed in. Ken Lindblom, you've enrolled a family through healthcare.gov. How do you check on it? Depending on the carrier that you enrolled it in, that's where you would go through to check it. You would call Coventry or Co-Opportunity and check on it. As of right now, there's still websites where you can go and track them, unfortunately. I don't know if that will happen later. With no subsidy, would the premium be the same for a given plan on or off the market? Yes, if there's no subsidy, the premiums are going to be the same. So if you know they don't qualify for a subsidy, honestly save yourself the headache and don't go out there. Okay. All right, Doug, you had a question?
Yes, am I muted?
Nope, I can hear you.
Great. I have some questions about the networks. There's a Premier, there's a Choice, a Preferred UI Health Alliance. I came across HD, HP, which I'm assuming is a high deductible, high premium. I don't know what the high deductible, what that stands for. But could you, when I was comparing the doctors, and I did a doctor search from healthcare.gov, and that allowed me to search the individual network, but I wouldn't know how to do it from Co-Opportunity. So I guess I would like to understand, apparently Preferred is, at least in the Quad City area, includes Genesis. It's basically an HMO, but most of the doctors and the hospitals and the clinics are in the Preferred network, but they're in the Choice and the Premier. I quoted one plan that was a 3-tier plan, and my understanding is basically you go with the HMO as Tier 1, and then Midlands Choice is Tier 2, but I guess I don't understand the networks and how to go about finding the doctors on the network other than going to healthcare.gov.
Okay. Yep, you're right. They do have 3 networks. The Premier plan is a PPO network. That's using Midlands Choice Premier network. The U of I, there's a Health Alliance, there's a Choice U of I, and a Preferred U of I. The Choice U of I has 3 tiers. And it has 3. The third's out of network. And depending on, you'd have to search to see where your doctor fell, would depend on the cost sharing for the tiers. Let me show you where we can go search for the doctors.
And also, when I'm looking at co-opportunity, and I have all the health plans displayed, and one of them, for example, is a co-opportunity preferred HDHP UI Health Alliance Silver CSR 94, and it says it's only on the marketplace, and it just is clear as mud to me.
Yep, well, CSR means cost sharing reduction. So it is only available on the marketplace for certain people depending on where you fall in the federal poverty level limits. HDHP is high deductible health plan. And so like you said, the U of I choice, that's your network.
Okay.
So log in to Co-Opportunity here.
Now, how do you know if at what poverty level, percentage of poverty level, they would qualify for this particular plan when it says only in the marketplace?
That's where you're going to need to go off to healthcare.gov and go through the application.
All right. Right now, we had to use the telephone on the enrollment that I did on Wednesday, and boy, I tell you, if this is a quality of our government employees, God help us. But one of the questions I had is if we have a 33-year-old female that basically is changing careers. She would make above the 400% federal poverty level in her previous job, but if she's going back to school and transitioning, technically she'd probably qualify for Medicaid. And I'm afraid of putting her at too low of an income level, because forcing her into Medicaid, aren't I really subjecting her to a lot of doctors that say we don't take Medicaid?
To be honest, I don't know how the Medicaid works, because that's, you know, a direct with Department of Human Services plan. One thing to keep in mind is this is a tax credit for 2014, so it is going off of what you're going to file in 2014. So if she's changed careers, you know, no longer working, her income is falling that low, and healthcare.gov says she qualifies for Medicaid, for her to receive any assistance with subsidy or whatnot, she is going to have to go to Medicaid. She can't choose to opt out and try to get a tax credit.
All right, but we don't know what, I mean, unless you know, you can predict the future better than I can, we don't know what her income is. We don't know if she's going to get enrolled in school right away, whether she was going to have a school health plan, whether she's going to have to go to work on a full-time basis and go to school on a part-time basis. So if I put her at a $20,000 income, she would get a $153 a month subsidy, but if we put her at $14,000 or $12,000, now all of a sudden she's pushed into Medicaid. So there's my dilemma. What do I do?
All you can do is go off of her income right now. With anybody, regardless of where you're falling in the category, it does tell you as you go through this that you need to report any changes. So if she qualifies for Medicaid right now, things change, she needs to report that, and that might change where she falls. She might no longer qualify for it and then need to go through the healthcare.gov to get a subsidy. You know, it's a tax credit, so they do have to report any changes, because it will true itself up on the taxes when you file. If what you're putting in here isn't going to match up, it's going to true itself up one way or another. So back to the find a provider. Let's see, generally it's a lot easier. If you're in the quote, there's a live link there that just says click on providers. And you can put, it'll tell you the tiers. I'm trying to find it for you here without going into a quote. Okay, so if you're on the main page, you don't even have to log in. If you scroll all the way down to the bottom, you can put help me find a doctor or hospital. It has these 5 tabs kind of in the middle. What I've learned is you need to click on Premier, Choice, or Preferred. Iowa Marketplace Choice is Medicaid Expansion, just gives you some information. And U of I Health Alliance, it just gives more information. So with Doug's example, he was talking about a Choice U of I Health Alliance plan. So if we click on Choice, that will be the network that we're searching. You can, then click Find a Doctor, Clinic, Hospital, Pharmacy, and it will tell you. We'll do it here, and you'll be able to see that it tells you what tier the doctor falls into. Be able to advise the client if they went to X doctor that it would be in this tier.
Now, as a general rule, if the doctor were in the Choice and the Premier and even the Preferred, it really doesn't make any difference which network they choose. They should choose the one that provides the best premium. Am I correct in that? Unless they are looking at flexibility of going out of state or out of network.
Right. If their doctor is in Tier 1 for the Choice and in all the other networks, you're right. If you just need to go through all the other factors. Do you have out-of-state coverage? Are you going to want that? Premiums, different things like that. Just like you would when you're talking about an HMO or PPO with Wellmark even. You just would need to go through all the different scenarios with your client. So here's an example. I just pulled one up quick. Has the doctor's name. If you look off to the right, it tells you what tier the doctor's in for the Choice plan. So you can look it up and see where they're going to fall. Okay, I'm going to Okay, Carol, did you have
I did not touch it.
Okay, we got a couple questions. Here it is. Did you have a question, Carol?
No. Okay, if there are no other questions, we'll move on to group. If you guys have any more, feel free to give us a call, especially if you have some specific situation questions that are a little more in-depth. Just go ahead and give one of us a call. Now I will turn it over to Tricia M. All right. right, I am going to go over group quoting, and I'm going to go ahead and start in Wellmark. All right, so once you get logged in to Wellmark, you are going to go to the quote, update, and enroll, which is right in the middle of the page here. And click on the first tab, same as the individual quoting. All right, and so to start the quote, we're going to go to activities. Well, there's two ways to do this. You can go to a recent quote and copy the quote to start one to do a new one on someone you've already done. Or you can go to new quoting and small group. A screen is going to pop up to ask if you want to do defined contribution or defined benefit. So you choose which option you'd like. Okay, once you're in this screen, you'll have to enter all the information for the company that you're quoting. I entered this company for Fort Dodge. You have to watch, if you enter a zip code that crosses several counties, this box right underneath the zip code will pull up a drop down. And make sure you select the correct county because the fees could vary depending on the county by quite a bit. You'll also want to enter the SIC code for the company. If you're unsure of what the SIC code is, you can select the search button. And you can search by entering a word, or you can browse the SIC code. And I guess if you go into these, it'll just pull up a list and just keep following it until you find what you like. Select the date you'd like the plans to be effective. Then you have the option to choose if you want to do medical, dental, vision, just check whatever boxes. Then you will need to enter the total number of employees, the total eligible, the total number in state, out of state, on COBRA, retirees, and then the total that you want to enroll. Before you continue on to the next screen, you'll have to assign an owner. So you can just choose whatever agent you want on there. Keep in mind, whatever owner you choose on here, if it's not yourself, they will get an email at the end of this. Okay, then once you select an owner, fill in that information, you can click continue. The next screen that's going to pop up is going to be the census or the group information. You have two options. You can manually enter these. You can add more employees by changing the number down here and selecting add. If you want to add family members to an employee, you can click on the employee and change the number of family members and add. I'm not going to do that. There's a census available. You can import, do ahead of time and import, which I have done. If you don't have the census, you can also export it from the screen and fill it out. And the census does update frequently, so if you go to import one and you start getting errors, just go ahead and export a new census to make sure you have the correct one. Okay, so I have imported my census. If there are any errors, you'll get a red error message at the top of the page, and you'll have to fix any of those before continuing. But once you have all of the employee information there, click continue. Okay, the next, you can kind of see too, I want to point out, the upper left-hand corner, there's a list of all the different steps, so it'll tell you where you're at, and you can go back by clicking on one of these. I'll pop you back to that screen. So the next screen that's going to pop up is going to be a list of all the plans, and it groups them off by PPO, POS, HMO, and HSA plans. So you can select however many you want. On Walmart, there's really not a limit to those. But the more you have, the messier the proposal will look and harder to read. So select the plans you'd like and click Add Plans. It will move them all to the top. Okay, once they're at the top, you can select any of these plans and delete them off the list if you'd like, and you can also continue to add more from below. When you have the plans you want, you can select Continue. The next screen that pops up will show you a list of the plans, and from here you can click on the right hand and view the member rates, or just click Continue. Okay, and this is the last step. It's going to give you the option to save the quote or email it. You can just choose what you want to be on the proposal that it sends, and it will, if you're logged in, it will email it to you. It will automatically email it to the case owner regardless if you check them or not, and you also have the option to email it to another individual that's not listed. And once you send the proposal, it automatically saves, so you can go back in and look up any proposals that you've done or any quotes that you've done. And from that screen, you can copy and change anything and rerun you don't have to make separate accounts for those. And that's all I have for Wellmark, so I will take any questions. Okay, Sherry, did you have a question? Okay, well, if there's no questions on that, we will go ahead and move on to the co-opportunity. All right, once you are logged into the co-opportunity website, you want to log in under the broker. On the right-hand side, you want to choose the 1 to 50 group. All right. Normally, I think it's because I'm on a smaller laptop, but normally these options are along the tab. But for now, I guess they're going to be on the right-hand side under this little box. And you're going to want to choose Group, New Quote. From here, you can also go into proposals you've already done and create new quotes for them. So we'll go with a new quote. So we'll have to enter the company information on the first screen. All right, so it's going to ask how many full-time employees we have, how many part-time hours we have a year, and it's also going to ask the total wages. If you don't have the accurate number, if you do enroll someone, it will come back and ask you to fix that, or you'll have to run a corrected quote. And then it will ask you if it's a nonprofit. Okay, the next page is going to be the census. You can do this two ways. You can manually enter the census on New Co-Opportunity also. To add employees, you just click the Add Employee button up here, and then it will give you the option to get in and add family members. I'm going to go ahead and import the census, so you'll want to click on the little down arrow on the right-hand side and import. And again, if you have any questions on the census, how to do it or where to find them, just give us a call or ask any questions when I'm done here. Okay, I'm going to fix my census real quick and then I'll import it. The co-opportunity census has a couple of columns that are required, like salary. And it won't let you import it without those. All right, so once the census is entered, you can also add employees to that if you need to. Sorry, it's running a little slow. Okay. Once the census is all entered, hit next, and it will take you to all the plans. I guess the only option on the screen is medical. I don't know why, but you have to select medical to continue. Then it's going to ask you if you want tier contribution or member level. The tier contribution is going to be if you want the management level paid differently. Member level is going to be just everyone paid the same. The next screen you get to will ask you if the employer wants to pay a certain dollar amount of the employee's coverage, dependents coverage, or put any money in an HSA. You also have the option of changing that to a percentage contribution by selecting the button underneath. Okay. Okay, so we'll just say this employer is going to do 100% of the employee, and no HSA, no dependents. Okay, so this is going to bring you to the plans. You have the option to filter this on the left-hand side. With Co-Opportunity Group, you can compare 4 plans at a time. I'm just going to select the first 4. Okay, and then you'll want to select Compare at the top. Sorry, I think we're having issues with the Co-Opportunity website at the moment. So bear with me and we'll try to get that next screen up. All right, so when you get to the screen that has all the plans on it, you're going to have to scroll midway through the screen. There's going to be an option to select the plans. Each plan you select will bounce into your cart. Once you've selected them, it should, oh, there you go, it will show in your cart there. Let's select a couple more. Okay, so you can, after you've selected the plans you want to look at, you have the option of going back, selecting 4 more plans to compare, and adding those to the cart, or you can continue. We're going to continue. All right. So the next screen is going to be the proposal review. It's going to go over all the information you have already entered. So it will go over the company information and address, the contribution level, the plans you've selected, and at the bottom you have the option to either apply, you can email the employer, or you can save as PDF. If you select any of these, it will save it. You can come back to later. We'll just email it to the employer. So I will email it to yourself, and you can also select the name and email that you'd like to, and you can type in a little message. And there is a little button at the bottom. You can't see it on my screen, but it just says send. Yeah, that's not how you spell my name, sorry. But we're going to go with that. All right, well, I'm having technical difficulties. There's a little box at the bottom that says send. I can't get to it right now. So that is the quoting through Co-Opportunity. I will go ahead and answer some of the questions I have on here. I am going to...
There's a question on here as far as what Wellmark Group rates, how they're competing with Co-Opportunity and their tax credit. On an individual basis, you know, really you have to look at everybody and every option. There's not set to age or income that we can say, you know, Wellmark's going to be better for these people or Co-Opportunity is going to be better for these people. It really is, every person is different, so you really need to look at the person as a whole and their income and whether they want the subsidies, whether they don't. As far as the group side goes, for them to be eligible for the tax credit on the group side, the shop exchange has been delayed until November of 2014, but there is still an application that needs to be submitted to healthcare.gov through the exchange that doesn't exist for the group to be able to get a response that says whether they qualify for that additional tax credit or not. 3 of the requirements are you know, the number of employees. They have to contribute 50% of the employee premium, and the average income has to be $50,000 or less than $50,000. But we have sheets on that out on our website, and Matt's emailed them out. If you have any questions about that, let us know. Does anybody have any additional questions or anything we need to go into more detail about? I don't see anything out here. Any hands raised? Well, I think we've went through the basics, I guess. If anybody has any additional information or additional questions, call myself, Tricia H., or Tricia M. She's been doing a lot of our group quotes and enrollments. We hope everyone has a wonderful Christmas if we don't speak to you before then, and have a nice holiday season. If nobody has any other questions, we'll go ahead and end the call. So thanks again, everyone. Bye.